I want to make sure that everyone knows we are in a crisis. The days look nice, the wind is blowing the trees, it's summertime, people want to enjoy themselves. But I want you to know that hospitals like LBJ have 100 COVID-19 Delta variant patients, and the number grows, and they need special care. At the same time, someone rushes into the hospital that needs other kinds of care. They rush to the ER that needs other kind of care. And Houston has always prided itself being a city with a top-notch medical system, public and private. United World Medical Center called. They need nurses, and they've been at the cutting edge of taking care of COVID-19 patients. There are drive-bys, which means you can't bring a patient to a certain hospital. They take them to United Memorial Medical Center. So let me, first of all, introduce our professor of nursing, Deidre Moore, who has been with me with nursing students, and I tell you, I've fallen in love with these nursing students who've been there with their natural caring attitude to help us with vaccinations. I know that they're going to be outstanding when the hospital is called to help them in the hospitals. Professor Moore?
Thank you, Congresswoman. On behalf of Houston Community College, our Chancellor, Dr. Maldonado, President of our College for Health Sciences, Dr. Nicotera, Dr. Sharp, Director of Nursing. I'm Deidre Moore, one of the adjunct faculty for the Associate Degree Nursing Program. And once again, we're excited to be a part of this opportunity for our nursing students to be able to work and serve the Houston community. We work with the Congresswoman on the COVID vaccination efforts, and we look forward to expanding our nursing footprint into the hospitals that care for our community. We know that the numbers of COVID cases are increasing in the hospitals. I appreciate this effort that has been taken for us to be able to assist our nurses who are currently working, and we can only imagine all of the hours that they have put in. I retired out of Anderson in 2017, and I've been working as adjunct faculty in the nursing program at Houston Community College for the last couple of years, and it is an honor to continue to bring out this next generation of nurses that, as the Congresswoman said, they're excited to be able to join in. And once we give them the information of this, I can only imagine the amount of excitement that them being offered the opportunity to go in and assist our nurses on today's. Thank you.
Thank you. I'll be standing at the hospital welcoming them, because I will be excited as well, because they are great assets to our community. Thank you to the Houston Community College School of Nursing. And now I'm delighted with another strong nursing program to have Dr. Sheila Jackson, who is the Executive Vice President of Lone Star College, who is equally excited about how we're going to move. In fact, I've seen her smile behind her mask and her affirming how enthusiastic her nursing students are. So we're delighted to have you here. That's Dr. Sheila Jackson. Thank you.
I'm just super excited on behalf of our Chancellor, Congresswoman, Dr. Stephen C. Head, and our entire team at Lone Star College. We sincerely thank you for your leadership in creating this opportunity for our students in the nursing program. We actually have about 25 students that are graduating from our Bachelor of Science in Nursing degree in 10 days, and 2 of them don't have positions just yet. And we also have another 60 students that are going to be part of the new cohort in our BSN program this fall. In addition, we have about 100 LVNs in the pipeline across our system and about 500 students in the pipeline for our ADN. And so we just are sincerely appreciative of this opportunity for students to be able to work alongside healthcare professionals and serve our community in this way. So again, thank you for the opportunity and for creating this for our students.
We will be reaching out to other nursing schools. There are other nursing schools in the area, and we will be reaching out to them. We are delighted that we have initial start, and we hope that as we converse with the hospitals, that we will have an easy partnership for these nursing students to move quickly into needed spaces for our wonderful community, the people who are in need. So I'm equally excited to be able to have, as I have with Professor Morin, another real practicing nurse of many years. And she has a major responsibility because she is the Chief Nursing Officer for Harris Health System. That is all of our public system, health system. They serve so many. They have outpatients with the gold cards. I think they're still called gold cards. And then they have a hospital system. They have health clinics. You have need for nurses everywhere. And so I'm delighted now to have Tony Cotton, Chief Nursing Officer of the Harris Health System. That is our public health system, which we could not do without. It serves so many of our citizens and friends, and they need help.
Thank you so much, Congress Sheila Jackson Lee. We appreciate you so much. On behalf of Harris Health and our president, Dr. Corsa, we want to say thank you so much for all that you've done for our community. Thank you so much to the nursing school for all your hard work and helping nurses to grow and get this great experience in the hospital. As Congresswoman said, we are a large public health care system that spans all over Harris County. We have over 40 ambulatory care clinics. We have Bentop Hospital, which is level 1 trauma center. We also have LBJ Hospital, which is also a level 3 trauma center. So lots of opportunity for our nursing students to come and learn. They are the next generation. They are the future. And we appreciate your innovation and forward thinking. Thank you so much.
I'm going to give my office number of 713-655-0050, which will allow retired nurses to call, and which I will direct them in your attention for you to make any determinations about their work with us. But we'll be focusing on nursing students. We've already heard of 500 throughout the system. I know that you have about how many going through your system, nursing students? And that means you have some that are in their first year already that will be ready to do it. They've had nursing training. So that would be a sizable commitment to helping fill the gap of our hospitals. And let me be very clear, nothing in this effort will jeopardize the care of any patient. Nothing will jeopardize the care. All of those who will be engaged will be under supervised medical professionals, including RNs, and they will comply with all necessary state laws. But I can assure you, they will be like Florence Nightingale, being of great assistance to the long hours. I was in a hospital the other day, not because of myself, but there was a 12-hour shift. And I know that years back I've been familiar with the I think you would call it the 8 to 4, the 4 to 12, and then the 12 to 8. Now we have people going 12 to 12. The days may be shorter, but now they may be going 12 to 12 hours, and they may have to stay even longer than the 4 days that they will be at work. I know that you're seeing that in your system because of the great need. So we're here to make a difference. We've asked, my office has asked, let me be very clear, my congressional office, as chair of the bipartisan task force on COVID-19, for the governor to lift this mandate. I'm asking respectfully, I'm pleading, because I'm in an urban county, and I need to have local authorities and school boards be able to determine how they work with their children when they come back. That I hope we get a response quickly. I hope the community joins me in asking the governor. I hope the Greater Houston Partnership joins in giving a free wheel, removing the burden for our schools to be safe, our communities to be safe, our local government buildings to be safe, because we realize that this is very serious. I did not read the COVID-19 document from the president, but his document has indicated that we're wearing masks. He's indicated that the military in certain places will wear masks. He knows that this is a challenge to all of us, but he also knows we'll not get through COVID-19, the Delta variant, if you don't wear the mask, if you don't get vaccinated. And I have to help my hospitals in my congressional district and beyond, because we hope this will help those in need to be able to get nurses and nursing students to be able to work with these hospitals to help the nurses that are already there to get relief, but to also provide for the new patients that are coming in that are in need as well. So let me close by thanking all of our health professionals who have carried the torch for so long. And so now we've seen them highlighted because COVID-19, the Delta variant, have had more people exposed to how necessary their work is. And when they're desperate, meaning the patients, to have a caring medical professional at your bedside. We don't want that to stop. We would rather you not be in the hospital. We'd rather you not have COVID-19. We'd rather you not have the Delta variant. But we've got to help our nurses. We've got to help our medical staff. We've got to help our medical system. And we've got to help our private and public medical system. I'm excited about this initiative, and we want to get it going as soon as possible. Any questions? I want to just close with this poster here, please, if you can. Yeah. This is a little dated because Texas is seen among others that have the highest cases. We now know that Texas is number 2 with Delta variant cases. They're number 2 in the nation. That is not the label that I would like. When we're getting ready to play high school football, we're getting ready to have high school back in, and they can be vaccinated, school back in, and we are number 2 with the Delta variant. So we know we need the mask mandate to be lifted and flexibility be given to our local jurisdictions, but we also know that we need to help our hospitals with our nurses. And I couldn't be happier that we're going to get going on our help of our hospitals, and I'm respectfully hoping that the governor will consider the crisis that we're facing and reconsider the mandate. And that means that people can make their choice. School districts working with their families can decide whether they are asking children and families to wear masks, but you give the authority to the local jurisdiction. And the final word is, it's all about saving lives. That's all we want to do, is save lives. Thank you all very much. Great. Sir, do you have the document